If you're turning 65 in 2026 or you're helping a parent navigate Medicare, I have a warning for you. This year, Medicare is undergoing some of its biggest changes in a decade. The Part B premium is jumping to over $202.90, and the Part D rules just got completely rewritten. If you don't understand how these 2026 updates work, you could lose a huge chunk of your Social Security check to penalties and hidden costs. Today, I'm breaking down exactly what new seniors need to know to avoid the traps and maximize their benefits. Let's dive in. First, let's talk about the cost. Most people think Medicare is free. It's not. In 2026, the standard Part B premium, which covers your doctor visits, is projected to be around $202.90 per month. That's a nearly $18 increase from 2025. If you're already collecting Social Security, this is automatically deducted. But here's the kicker. If you have a higher income, you might be hit with IRMA surcharges, which can push that monthly cost way higher. Pro tip, if you're still working and have employer insurance, don't just sign up for Part B blindly. You might be able to delay it and save thousands, but you must follow the special enrollment rules to avoid a lifetime penalty later. Now, the best news for 2026 is the $2,100 out-of-pocket cap. Thanks to the Inflation Reduction Act, starting this year, the absolute maximum you will pay for your prescriptions in a calendar year is $2,100. This is a lifesaver for seniors on expensive brand-name drugs. But wait, there's a catch. The Part D deductible has also risen to $615. This means you pay the first $615 yourself before your insurance kicks in a dime. Also, watch out for the prior authorization pilot program starting in states like Texas, Ohio, and Arizona. Medicare is getting stricter about which procedures they approve. Always ask your doctor, is this pre-approved? The biggest question I get is, should I get a Medicare Advantage plan or a supplement? In 2026, Medicare Advantage Part C plans are offering more dental and vision, but their networks are getting smaller. You might find that your favorite doctor is no longer in-network. On the other hand, Medigap supplements like Plan G are more expensive monthly, but they give you total freedom to see any doctor in the USA. If you travel or want peace of mind, Medigap is king. If you're on a budget and don't mind staying in a network, Advantage might be for you. But choose carefully. Switching back later can be very difficult depending on your health. Mark your calendars. If you're already on Medicare, the annual enrollment period is October 15th through December 7th. If you're new, your initial enrollment starts 3 months before your 65th birthday. Miss this window and you'll be stuck with a 10% penalty for every year you waited. That penalty stays with you for life. Medicare doesn't have to be a nightmare if you have a plan. I've put together a 2026 Medicare checklist in the description below to help you stay organized. If this video helped you, please hit that like button and subscribe. We're helping thousands of seniors navigate retirement without the stress. Comment below, which state are you in and what's your biggest worry about Medicare? I'll try to answer as many as I can. Thanks for watching.